Much of the research that's been done on oxygen's use in the body was done by a guy named Otto Warburg. And what he discovered was that cancer cells do not use oxygen to produce energy. In other words, cancer cells are anaerobic. Much of Warburg's work has been misrepresented to say that oxygen kills cancer cells, and it doesn't. Because if it were that easy, a cancer cell could just get shot up with oxygen and everybody would be cured. In the 1960s, Manfred van Ardern developed oxygen multi-step therapy. And this is a way that he could determine that the body would increase the absorption rate of oxygen. And what he saw was a 70% decrease in metastasis from this. So what was Ardern's theory about how this works? Well, we all know that the body oxygenates itself through the vascular system. But as we go through life, with more stress and damage to the vascular system, this becomes more and more difficult to oxygenate the body. Any stress beyond the body's adaptive ability to repair itself will eventually cause damage. And this could be in the form of many micro stresses or one big macro stress. And there are 4 different types of stress that we deal with. One is physical, from accidents. Another one is chemical. It could be from pharmaceuticals, pollution in the air and in the water. A third stress would be thermal, which could be heat or cold. And finally, emotional and mental stresses. Every one of those that goes beyond the body's adaptive ability to repair itself will cause damage. Damage triggers inflammation. Inflammation is the way the body goes to heal itself. But when your body inflames, it will decrease the size because of the compressive forces on the capillary, making the capillary smaller. When that gets too small for the red blood cell to go through that capillary, everything downstream of that capillary becomes hypoxic, meaning it's surviving in an environment without oxygen. And if that goes on long enough, those cells will become senescent or dormant. And they're there, they're alive, they're just not working. What oxygen multi-step therapy does is it creates pressure to super-oxygenate the red blood cells in the plasma so that can burst through those areas that are having inflammation, making the functional area of the capillary smaller. So it blows through that. Once that oxygen gets delivered to the senescent cells or the dormant cells, now they have the raw material necessary, oxygen, to start creating ATP. Once the mitochondria start creating ATP, now that cell can get cellular energy back and begin to function normally. One thing that we see every year is a slow degradation of our body's own health and our body's own abilities. Now, death is going to come to all of this. Every year, our eyes sag a little bit more, our skin gets a little bit more wrinkly, our hormone levels, our sex hormone levels are not at what they used to be, our fatigue levels a little bit greater. That's just a part of normal aging. That being said, aging shouldn't happen that quickly. Aging should happen at a normal rate. But any type of damage to the body will put the body in a state of fight or flight. And if that damage is never corrected, over time, it will cause aging at a faster rate. What oxygen multi-step therapy does is it begins to bring that rate down to a more normal aging level for you. So you don't anti-age, you actually age more normally. Now, there are 2 ways to super-oxygenate the body under pressure. One is hyperbaric oxygen chambers. And we know about this from Michael Jackson, who used to sleep in one of these, allegedly. The way hyperbaric oxygen chambers work is they raise the pressure inside the chamber to at least 1.25 to 3 times the normal atmospheric pressure. And they fill the chamber with 100% medical grade oxygen, and that forces oxygen into the body, to the cells, to super-oxygenate the capillaries that have swollen up and to push oxygen through that. It does that completely by pressure, a cabin pressure. Now, there are a few things to note here about hyperbaric chambers. Number one is they're very, very expensive. For $10,000 you can get one, but they're about 1.25 times atmospheric pressure. There's no research on them. It starts at 1.4 times atmospheric pressure. So to get a really good medical grade quality one that's 2 to 3 times atmospheric pressure, you're looking at anywhere between $500,000 and $1.5 million to get something that is more research grade. So to get any real therapeutic benefit, you're going to have to shell. You can't shell out $10,000 for a soft chamber, hyperbaric chamber. You're going to need to spend a lot of money. Or you're looking at maybe $500 a session or more because you have to pay for a doctor's time and the machine time. Now additionally, the FDA has only authorized hyperbaric oxygen to be used for something like 13 diagnoses. Most of those are like gangrene, burn victims, nothing that really is a very much a threat to overall society. Plus, the number of sessions required for this to work is anywhere between 30 to 100. Hyperbaric oxygen is really for people that are extremely deconditioned or have a specific FDA-approved usage for the hyperbaric oxygen. Instead of using outside pressure to super-oxygenate the body, Manfred van Ardern decided to use exercise. A brilliant way to do this. Exercise increases the heart rate of the individual. It also will increase the blood pressure, but it also causes vasodilation. And once the proper heart rate is hit, when oxygen is flushed into the system at that point, then it could blow through these areas of swollen capillaries and blow into the areas that are downstream, causing the hypoxic areas to become oxygenated and giving them a chance to get up from their dormant condition. A very easy way to think of that is think of this as a garden hose. If you have a garden hose and you just let the water come out, it just kind of rolls out. But if you put your thumb in front of it, it shoots out. Think of that's what's happening with van Ardern's oxygen multi-step therapy technique. It's supersaturating the blood, the red blood cells in the plasma, and it's blowing it through those senescent areas. So those areas that are swelled up from the damage to the vascular system, it just blows right through it. Now, recent updates to van Ardern's technique include decreasing the oxygen content to below sea level. For instance, right now at sea level we're about 21%. Recent updates require decreasing the oxygen level to the subject to 10%. The reason that's effective is because when you decrease the oxygen content, now the blood vessels will dilate even further, causing further vasodilation to allow oxygen, once you hit that ideal heart rate, to be blasted right through at full oxygenation to the body. This will provide a far better absorption of the oxygen, and using this technique, we can get these sessions down to 15 minutes now. So instead of spending an hour or longer in a hyperbaric chamber, you can spend 15 minutes using oxygen multi-step therapy, and within 4 to 7 sessions, you'll see changes and more optimal changes coming between 10 and 20 sessions. So who's this therapy ideal for? Well, certainly anybody that has a brain injury. Imagine you're getting a concussion where your head's hitting your skull, causing bruising and inflammation to those blood vessels going into the brain. What about stroke victims when they're not getting the oxygen there? Using this technique allows to blow through and supersaturate those areas that are not getting any oxygen with oxygen. Initially mentioned, van Ardern noticed a 70% decrease in metastasis. And again, it wasn't because oxygen was curing the cancer. It can't do that. But what it does is it blows, the cancer and the tumors will cause pressure on the structures outside of that area. And that will cause inflammation and damage to those structures too. What the oxygen multi-step therapy allows is that to be blown through and oxygenate those areas. So what it does is what his theory was, it was sequestering the cancer or the tumor from getting any bigger because it was keeping the tissues around the cancer or the tumor very healthy. Other people that would benefit, anybody that has toxicity issues, that took lots of pharmaceutical medication like I did when I was a kid. People that are extremely stressed out, going into flight or fight. Their body is causing damage to the body and the vascular system. This is why stressful people that are always stressed seem to have a higher rate of blood pressure, cardiovascular issues. This is a way to start bringing healing to those areas. Would you like to live longer? I can guarantee if you cut your oxygen supply down, you won't live as long. Have you accumulated lots of injuries, lots of traumas over the years? You're not the person you used to be? Oxygen therapy, multi-step oxygen therapy is one of the easiest ways to increase the vitality of the body. It's very simple physiologically. You increase the rate of the body's pressure with the vascular system. You add oxygen to blow it through to super-oxygenate the body. You let your body start creating ATP, invigorating the cells, invigorating life in your body. It's very simple and a very cost-effective solution to many of the common symptoms that we're seeing today.